Good morning. I'm Dr. Thaddeus John Bell, and I'm happy to be in Georgetown, South Carolina, with my fraternity brothers from Iota Tau. We are getting ready to put on a men's health conference, and I want to introduce some of my fraternity brothers from Iota Tau. The organizer of this has been Alonzo Wilson, and I will ask Alonzo first to introduce the brothers who are standing with us, and then we'll talk a little bit about why we are here today.
All right.
Okay?
As mentioned, my name is...
Y'all can loosen up, by the way. We're here to have a good time.
All right.
Okay.
My name is Alonzo Wilson. Behind me to my right, I have Brother Leonard Nelson, and to my left, I have Brother George McDaniel.
Okay. I was asked to be a part of this several weeks ago, but this project has really been the brainchild of this chapter. So, brothers, tell me, why did you all decide to put on this health conference today?
So we wanted to find a way to uplift the community, make them aware of health and wellness through various means of health characteristics such as vision, prostate cancer, dental, and etc.
Good. Yeah, I know the title of this conference today is Uplifting the Community.
Yes.
I'm correct about that? So anyway, we are very happy to be here this morning, and we're looking forward to having a good time. We have representatives throughout the community in the healthcare profession. And again, I'd like to thank Iota Tau for being the brainchild of this program today. And brothers, we're looking forward to having a good time.
All right.
All right. Thank you, brothers.
All right, thank you, Dr. Bell.
All right. Good morning. Say that again. Good morning. Good morning. Okay, I'm very, very happy to be here. I'm going to make a few acknowledgments before we get started. First of all, I want to say how much I appreciate the brothers of Iota Tau for inviting me to come to Georgetown to talk about health issues and health disparities. I want to also let you know that this part of the program is sponsored by South Carolina DHAC and the CDC, who has given us a grant to talk a little bit about cancer and other health issues that affect African Americans. So today, I want to spend some time talking to you about tips for surviving cancer. And then at the end of that talk, I'm going to talk to you about some other issues that I think are important with reference to helping to decrease the health disparities that African Americans and the underserved have to deal with. I'm going to tell you right from the very beginning some of the things that I'm going to say. Black people oftentimes do not like to hear. I'm sure some of my colleagues can appreciate that. But they are some of the things that I'm going to say. They are the truth. Just to tell you a little bit about myself, I've been practicing medicine now going into my 44th year. I became very, very interested in the health disparities as a result of being a student at the Medical University of South Carolina back in 1972. When I saw a lot of health disparities that really upset me, I couldn't understand why black people had more illness and died quicker than any other group of people. I thought it was something that was just in Charleston, South Carolina. I couldn't understand while the medical profession that's supposed to be taking care of everybody was discriminating against African American people. I couldn't understand why African Americans didn't take their own health seriously and actually contribute to the bad outcome that we were experiencing. And so I thought it was just a Charleston, South Carolina issue, and then I went to Richland Memorial Hospital where I did my residency, and I saw where it was an issue at Richland Memorial, so I became very aware, and after talking to many of my colleagues, that it was an issue in South Carolina. And then I was invited back to be the associate dean in the College of Medicine for medical students, and also to help the medical university increase the enrollment of African American students throughout the entire college, the entire university. And I became aware that one of the issues was that we just didn't have enough black people taking care of black people. That was the other thing that I became very familiar with. And then I became aware that this was a national problem. It was really a national problem. So I decided that I would dedicate my life, because I was very, very blessed. I was not the brightest person applying for medical student, and I promised my maker that if he let me in the medical university and help me get out of the medical university, that I would try to give back to the community. And so that's how we started closing the gap in healthcare. And so recently we have partnered with DHAT to do health tips throughout the entire state of South Carolina. And I must admit that this is the first video that they've asked me to do to address some major issues. So that kind of gives you a capsule of how I got to this place. So thank you very, very much for being here. I'm going to give you an opportunity to ask some questions as I go through this short presentation on tips for survival. I might also tell you that I'm a cancer survivor. I currently have prostate cancer, and currently under close surveillance. And cancer has touched my life in a lot of ways recently. I recently lost a daughter who was a very, very much part of what I do. She was an AKA, and she passed away from a rare form of cancer at age 33. So that happened just 2 or 3 years ago, so I'm still dealing with that. So today, though, we are going to talk about what's needed for cancer survival. First, we're going to talk about smoking. I don't know about y'all, but whenever I see someone smoking, I always ask myself, what is it that they don't understand that smoking kills people? And as healthcare providers, all of us understand that smoking is the leading cause of lung cancer today. But something that you may not understand is that even secondary smoke. Now, secondary smoke is when you're around people who smoke and you inhaling their smoke. That's almost like you're smoking it too. Okay, so you need to get from around those people. So smoking causes about 10 different cancers. I don't have time to go through all of them today, but it causes 10 different cancers. Cancer of the lung is just one of them. It causes breast cancer, causes bladder cancer, contributes to colon cancer, pancreatic cancer, and the list goes on and on. Not to mention that smoking is a major contributor to a major problem that affects African Americans, and that's diabetes, hypertension, strokes, heart attacks. So black people, we should not be smoking. And if when I'm driving down the street and I see people smoking, I almost want to get out of my car and say, what is it that you don't understand that smoking kills black people? Okay? So smoking is not good. Smoking also is a major reason that you're going to need to stop with that behavior if you are a cancer survivor. Because if you continue doing what you did before, the cancer is going to come back. So you're going to have to let the smoking go. Okay? Any questions or any comments about smoking? The second thing that is a contributor to your survival after you've been diagnosed with cancer is drinking. If you have been consuming a lot of alcohol prior to drinking, then there is a chance that the alcohol will cause a resurgence or it will cause the cancer to come back. This is very, very well documented. Now, I'm not saying that you have to stop drinking altogether. I'm just saying that you have to drink in moderation. There are new studies that are coming out, particularly showing that the millennials, you young people, drinking too much. And as a result, we are beginning to see an increase in liver cancer in millennials. Okay? But the bottom line that I want to recommend to you today is that you should decrease your drinking if you're a cancer survivor. Decrease your drinking. By the way, beer is alcohol. All right? Because a lot of black folk think that beer is not alcohol. Beer is alcohol, so if you've been drinking a six-pack every other day, you're going to have to cut that back and drink maybe 1 or 2 beers a day, perhaps none at all, and a very decreased amount on the weekend. So we want to encourage you to decrease your alcohol intake if you are a cancer survivor in order to continue living a long life. By the way, smoking and drinking together is a double whammy for developing cancer. Yes. You want to take the mic?
Not particularly, but okay. Are there any studies about red wine? Because there are individuals, none in this room, who feel as if red wine, helps in some way.
Well, if you're a cancer survivor, you can drink a little glass of red wine or white wine, but you can't drink the whole bottle. Okay? You want to keep in mind that everything is in moderation when you become a cancer survivor. Okay? All right. Now, here's one that we don't like to talk about in the black community and that I'm very, very big into, and that is exercise. If you don't remember anything that I say today, I want you to remember that exercise is medicine. Exercise is medicine. When you survey people who have developed cancer, they don't have a history of doing a lot of exercise. But once you have developed cancer, and even if you are under treatment, we have new studies to show that even if you're on chemotherapy or getting radiation treatment, if you can get up enough energy to go out and do some exercise on a daily basis, you're going to increase your chances of being a cancer survivor. Now, I can talk about this particular subject for the next half an hour, but I don't have time to do so, but I do want to make you aware of this. Many of you have what they call the Fitbit, you know, that little watch that you put on your arm. And you will be impressed that in order for you to get in the appropriate amount of exercise daily, it ain't just 2,000 steps a day. It's 10,000 steps a day. Now, you know, most people think, well, I get 10,000 steps a day just from doing my work. Put that Fitbit on, and it will tell you you're nowhere close to 10,000 steps per day. So if you can do that, that's a good modern way of keeping up with your exercise. But I want to also make you aware that trying to get in 150 minutes a week of walking is a step in the right direction. That's about 30 minutes a day, most days of the week. Now here's some new information. I go to the gym on a regular basis, and I see people on the machines, and that's good. But the new studies are showing that in addition to being on the machines, you have to do some resistance training, some weight lifting. Now, I was on radio just the other day talking about this, and the question was asked of me, well, you know, I'm a little dainty female, and I don't want to get all muscular doing fitness, doing weightlifting. And I had to tell the young lady, and I'm telling you too, you can't be in the gym enough as a female to develop muscles. In order for you to do that, you almost have to spend 5 or 6 hours a day lifting weights. The new studies are showing that if you want to increase your survival, you gotta lift some weights, because weights stimulate muscles to grow, they stimulate muscles to metabolize correctly, and here's new information, it also stimulates bone strength. Bone strength. So if you're going to the gym and you're just doing cardio, you also want to put some weightlifting on there. Now, I would encourage you to seek out the person in the gym to help you learn how to lift the weights or to do the weights, because if you do it incorrectly, you're likely to hurt yourself. I want to also make you aware that as you get older, you will notice that you ain't going to be able to do certain things. All right, you young people don't know that yet, but trust me, you'll find out. I'm approaching my 75th birthday, and I have noticed since I turned 70 that I can't do the muscular things that I used to do unless I'm in the gym on a regular basis, at least 2 times a week, doing some type of resistance training. So I would encourage you that if you want to decrease your risk for developing cancer, start a fitness program, Fitness for Life. Fitness for life. When you get 90, you still want to be doing some fitness. I remember a couple of years ago, I had a patient who was approaching 100, and the family came in to see me, and they wanted me to discourage their mother from going out in the yard. She lived in the country, and she was accustomed to sweeping the front yard, and they wanted me to discourage her from doing that. And I said, you don't understand. The reason that she's lived to be 100, is because she's been going out there doing something. And I also had to remind them that she's on less medications than y'all. Okay? So Fitness for Life. You want to be a cancer survivor, you got to get a fitness program, you got to stick with it, even if you're on chemotherapy or radiation. It's challenging, but you have to do it in order to be a cancer survivor. Okay? Any questions about fitness and exercise? Something that's rare in the African American community, but you can't be a healthcare professional telling people how to be healthy if you're not telling them about fitness, because it's a part of what's going on in medicine today. Now here's something that's new on the horizon that we're beginning to talk about, and that is stress. Stress. A major cause of recurrence of cancer if you're under a lot of stress. We know that stress contributes to diabetes management. We know that stress contributes to hypertension. We know that stress contributes to mental illness. We also know that stress contributes to the resurgence or the coming back of cancer if you've been diagnosed. So you want to decrease your stress level. Stress in relationships, stress on your job, stress in just dealing with people in general. You have to every day find a place where you can de-stress. For me, that's when I go to the fitness center, because I can't find nobody to go there with me, so I don't have to be dealing with people, okay? So I go to the fitness center with my earphones on, and I listen to the kind of music that I like to listen to, but I de-stress. Try to do it on a daily basis. Sometimes when I'm walking in the morning, walking and praying and de-stressing, I would encourage you to remember that stress is a very, very important part of continuing to be a cancer survivor. Stress. And of course, with all of the things that's going on in the world today, when you look at television, you just get all stressed out. Lord have mercy. I ain't gonna even go there. All right? Okay. Now, one of the things that black people like to do, we like to take a lot of pills. You know, it's interesting to me. We go to the store and we buy all these pills. We get some vitamin E, some vitamin A, some vitamin C, some vitamin D, and F. I had a lady come to my office and she had a bag of vitamins. And I said, I didn't put you on all of this stuff. Why are you taking this? Because my cousin told me this. And my cousin told me that. No. Okay? If you want to be a cancer survivor, talk to your doctor before you start taking a lot of vitamins. Most vitamins do not work for cancer. There are a few that your doctor will discuss with you. For men, it may be vitamin D. There are some studies to show that vitamin D decreases the risk of developing cancer, prostate cancer, particularly for men. So talk to your doctor, talk to your oncologist before you decide to invest in all of these supplements. They're making a whole lot of money off of black people from taking supplements, I can tell you that. Okay? Very rarely do I prescribe supplements. Now, here are some times that I do. For women, they need calcium. Sometimes they need vitamin D. I will prescribe those things. But those things are not prescribed without me doing a test of some kind to say that your calcium level is low or your vitamin D level is low. So supplements have their place, but not just going to the store getting some just because your girlfriend told you that it seemed to work for her. One of the misnomers too is vitamin C does not work for a bad cold. You're just wasting your money if you just have an expensive urine. If you're taking vitamin C for a bad cold, that does not work. Okay? And the studies show this very, very clearly. Are there any vitamins that you ladies recommend for strong teeth that you all know of? I can't think of anything right offhand. Can you think of anything right offhand? Vitamin D too? And just to kind of eat healthy. Yeah, okay. All right. Any questions about supplements? Okay. Now the next thing is eating healthy. We can talk a long time about this, and frankly, when we start talking about diet, I usually defer my dietary recommendations to the dietitian because they are trained to talk in more depth about that than I am. But there are a few diets that I can recommend to you, and there are a few dietary things that I can recommend to you. If you want to be a cancer survivor, you got to change the way that you were eating before you got to cancer. Because we have very good studies to show that poor diet contributes to major cancer risks. Some of the diets that I would recommend. Have you ever heard of the Mediterranean diet? You ought to Google that. I'm not going to go, I don't have time to go into it, but Google Mediterranean diet. Google DASH diet. If you want to be a cancer survivor, you got to maintain a healthy weight going forward. Now, weight is one of those subjects that black folk do not like to talk about. And the reason why is because we have a major epidemic of obesity in the African American community. Major, and a major contributor to cancer. And in my 44 years of practicing, I've had lots of patients to leave my practice because I want to talk to them about their weight. But it is a major contributor, and you can't come see me, and I'm looking at you, and you 40 or 50 pounds overweight, and you don't expect me to talk to you about that. That ain't gonna happen, okay? So, I'm not gonna stay on that, but I do want you to know that it's a major issue in the African American community, and it contributes to strokes, diabetes, hypertension, cancer. There's a common thread that runs through all of those. And the common thread is, those are the things that are killing black people. Okay? So you want to eat healthy, you want to maintain your portion size, and you want to eat fruits and vegetables every day. Want to cut back on carbohydrates, cut back on red meat, cut back on processed meat. Those things are not good, and we know that if you want to be a cancer survivor, you got to decrease the intake of those bad things that I just mentioned. Any questions or comments about eating healthy? None. Okay. All right. Listen to the cancer doctor. I'm not going to, every time I see this part, I think about Tanisha, my daughter, and when she developed cancer. I'll just tell you this, that she got a bad prognosis right from the very beginning. The doctor said, look, this is the worst cancer that you can have. So it was a bad prognosis. But she took the high road and said, well, we're going to do everything that we possibly can to make the outcome not bad. So she did everything that her cancer doctor told her to do. And fortunately enough, when her cancer kept getting worse, we sent her to some of the best places in the world to get it taken care of, but it was not to be. But you have to listen to your cancer doctor. And if the doctor tells you that you need 50 treatments of radiation and you just do 25, that ain't gonna get it. You gotta do all 50. And if he tells you that you have to take the pill for breast cancer every day in order to be a survivor, you gotta take the pill every day. You can't skip it, okay? You have to take it every day. So listen to the cancer doctor, do what the cancer doctor tells you to do. Now, there are some barriers, and we don't have time to talk about that today, but there are some barriers, particularly that African Americans and the underserved population have. We're following through oftentimes with what the doctor recommends. Financial barriers is one of them. I always tell churches that if they want to do something to help the membership of their church, find out how many people in the church got cancer, and then make a financial contribution to help them defer the cost of the treatment. That also decreases the stress of not being able to pay for the treatment. Okay? So, listen to the cancer doctor. Now, you also have to listen to the other doctors, because most of the time when people develop cancer, they just don't have cancer just by itself, because the cancer usually runs with other medical issues. So you have to listen to your primary care physician as well. I'm finding in my years of practicing that when people develop cancer, the one problem that they have that's running with it that they didn't know was what? Where's the diabetes lady? Diabetes, that's exactly right. I'm finding that most of the time when people get diagnosed with cancer, when the primary care doctor starts working them up, they find out that they have sugar. Y'all call it sugar down here? Okay. Sugar diabetes? Yeah, okay. Sugar, just sugar. Yeah, okay. Okay. All right. But in addition to that, sometimes the cancer treatment will cause problems. Sometimes the cancer treatment will cause your blood pressure to go up. The cancer doctor is not interested in that. He's interested in how the medicine is going to affect the cancer. You got to go back to your primary care doctor and let him deal with the high blood pressure or the diabetes or the arthritic pain that you may be having. So stay connected to your cancer doctor. Stay connected to your primary care doctor in order to be a cancer survivor. What happens in the African American community, particularly with men, is that they will get diagnosed with prostate cancer early. And the doctor will say, well, you know, we've taken your prostate out, but you need to have follow-up every 6 months to get the PSA to make sure that it doesn't start rising back up. So the brothers, well, they said, well, you know, I ain't feeling nothing. I'm feeling good. I ain't going back to that doctor no more. Okay, so they stay away for 2 or 3 years. And then all of a sudden they get sick. They come to see me, and I see where they've been diagnosed, and I say, well, have you been back to the medical university to get followed up? And they look at me as if I said, come on, man. You were supposed to go back for the follow-up. So in order to be a survivor, if the doctor tells you that you need to continue having your breast evaluated, you got to go back. You got to go back for the prostate cancer follow-up. You got to continue getting the colonoscopy. Okay? So follow-up is very, very important. Any questions about that? Can I get an amen? Amen. All right. All right, and then the final thing that I like, we are in a church today. I'm a man of faith, and I believe that you have to pray. How many of you believe you have to pray? I believe that you have to pray. And you have to ask God for long life and let his will be done. Okay? Even when I'm walking, when I'm seeing patients, I see some bad stuff all day long with black people. You know, folk used to think that being a physician is a glamorous thing, but it takes its toll on you at the end of the day. See a lot of stuff that's happening to people. Racism, bad information, social determinants affecting the health outcome of patients. And you know, as a doctor, you're trying to, we're accustomed to fixing stuff. We like to fix stuff. And if we can't fix it, it makes us feel very, very bad. Sometimes we can't fix it. We can only just make recommendations. So that's the end of this part of the talk. Tips on survival. By the way, I have a survey here that I'd like for you to take. make sure you take it and answer it, because I need to give it back to DHAC, because this video is going to go out to other people around the state of South Carolina, and so I want to make sure that we get some feedback on whether you learned something from this talk.